Hi, I'm Stephanie.
And I'm Zach, and this is episode 585 of the Lawyerist Podcast, part of the Legal Talk Network. Today, Stephanie talks with Soumya and Jill from Mental Health First Aid about, well, mental health first aid.
Yeah, pretty much.
So we've actually, in full disclosure, we've done this intro before, and Stephanie knows that it kind of blew my mind to think about first aid for mental health. And so this is a fascinating episode for me. This is something that had one of those like glass breaking sort of moments of like, oh, okay. So I would suggest that people stick around and listen to it. But before we get to that, the elephant in the proverbial conference room, we just got back from ClioCon, Stephanie. That was some big doings, some things announced.
Yeah. It was a lot. A lot of news from the stage during Jack's keynote address, and we interviewed him about some of those later. So that will be coming out soon. But if you haven't heard, a lot of people know that they acquired VLEX or in the process of acquiring VLEX once some regulators approve the deal. And they announced Clio Work as a place where you can bring your practice management, your case management, and actually the work that you do as a lawyer all in one place, leveraging both research tools and AI, all through Clio Work.
Yeah, so this is like pending regulatory approval. We have a couple of interviews related to this. As you can imagine, while we were there, we were interviewing a lot of people talking about this. But now, from what I was told, you have Clio Manage, Clio Grow. So Clio Manage, where you manage your firm. Clio Grow, where you do your intake and your client kind of management and things like that. And then Clio Work, where you do the actual work of being a lawyer. And they're going to use Vincent, at least the underlying AI of Vincent, once the regulatory approval comes through, right?
No, let's be really, it's available today.
Is that okay?
Yeah, the regulatory thing is just going to allow them to close the deal. They're just waiting on Spain to approve the final acquisition of the company, but they already have Vincent and Clio Work in place today. It actually released last week at the conference. So if you're a Clio user, now you have to subscribe. Like if you were a Duo user, you're getting early access to this right now. But if you want to add work onto your subscription, you can do that today and start leveraging this tool.
I'm interested to see how it, essentially I think it's going to supersede Duo, right? It's kind of going to...
Well, it's different, right? So, I know it gets complicated, and I think Jack even struggled to break all this down in a quick keynote.
We're going to have a lot of videos on this coming up.
Yeah, I think I think one of the things that we're going to be helping people with, I talked to someone about this morning, is rolling it out in their firm and training and understanding it all.
Yeah.
Because there's a lot of different facets to it. So work will be where you could use AI to research case law and draft a response to your pleadings, right? Draft contracts that comply with different cases. So think about that. Work is where you use AI to do the legal work, but there are also AI components previously called Clio Duo, now renamed, both inside of Clio Grow and inside of Clio Manage. So you may not have a work subscription. You may just be using Clio Manage, but you're going to find that there's AI capability inside of that product now. I think called AI Manage or something.
I think it's something like that, like Manage AI, Manage, Grow. They're just not calling it AI Grow. Yeah, exactly.
They're just not calling it the Duo name anymore. But and we're talking about this all the time. I know everyone's probably like, "Are you guys sick of talking about AI?" And it's like, there's so many different avenues and facets and ways you use AI, because there's some level of personal productivity that people can use for AI, right? There's marketing tasks that you can use for AI. So those are going to show up inside of, in this case, Grow. There's also like legal work you can do, like role specific work you can use and use AI. So I think I appreciate that people probably, I mean, Jack even acknowledged this at Clio's and his final keynote last week, that people were feeling a little overwhelmed, a little like, hey, I need to process all this. It's a lot coming at us. And I think I can speak for a lot of people that are probably listening and say, yeah, we get it. Because not only did Clio announce all these tools and all these new things, these tools are coming at us fast and furious. Like every day there's a new tool or new capabilities of the tools. And it's almost a full-time job on our team that we have just to keep up with all of it.
Yeah, absolutely. Well, I'm going to take this moment to actually plug our YouTube channel. If you're listening to this in podcast land, we have a YouTube channel. You can go to youtube.com/lawyerist. I mean, it's pretty easy. We've been there a while. We have videos, instructional videos, explanatory videos. We have all of our podcasts on there. So some of you are probably listening to this on the podcast through YouTube. But if you're not, hop over there, and there's a lot of instructional video. And we're going to be releasing a lot of the interviews that we did at ClioCon with Cleons, with attorneys that were there, and we're going to be trying to get a little bit of a discussion going there too. So if you've got questions about what this is, we want to hear those. We want to start talking about those with people, and we want to really dig into some of those issues that you think are coming out. So yeah, so pop over to it's youtube.com, I think, but it's our Lawyerist channel over at YouTube has a ton of resources.
Yeah. So now let's check out my conversation with Soumya and Jill and learning about what it means to be a mental health first aider.
Hello, everyone. My name is Jill Kluesner, and I'm the owner of Jill Kluesner Consulting. I'm a former provider, advocate, educator, and curriculum developer, as well as a public health programming consultant. So I develop and facilitate mental health literacy programs, including mental health first aid, to a real wide variety of audiences, including law firms, professionals in the legal field, and really focusing on that intersection between mental health and the legal industry.
Hi, everyone. I'm Soumya. I'm a licensed psychologist. I'm a restorative justice practitioner. I'm also a national trainer focused on mental health literacy. And as part of my work, I partner with organizations and schools to design programs that strengthen mental health and restorative practices and center relationship-centered spaces. Specifically within the legal industry, I facilitate mental health first aid for legal professionals, covering topics like how to support colleagues who are experiencing a mental health challenge, how to practice self-compassion in high-pressure environments, how to build communities of practice, and how to make sure that when you take trainings like mental health first aid, they don't just become like a one-and-done workshop, that you can continue and sustain the learning.
All right. Well, two impressive guests here today. And I feel like we could talk for hours about all the things that you guys just said just in that little introduction. But I was excited to talk to you today about the mental health first aid training because I was fortunate enough to be your trainee. Like you guys both came into our team and trained me and all of the team leads. And I just found it was so impactful that I was like, we have got to share this information and get it out in the world. So maybe to kick it off, you guys could define what it is and what you do, and we'll go from there.
So mental health first aid is the help offered to somebody who's experiencing a mental health challenge or experiencing a mental health crisis. So mental health first aid in and of itself, it's a training program. It's a standardized curriculum that teaches those specific skills. So you not only in mental health first aid training learn how to provide support, but you also learn about the resources that are available that you could tag in if somebody did need that extra layer of support.
The other thing that I want to add to what Jill said is mental health first aid is a movement. So that's how the way that we like to describe it. It started about 25 years ago in Australia by Betty Kitchener and Anthony Jorm. And essentially, they had this conversation that, we know what to do in around physical health challenges and physical health crises, but we don't know what to do when there's mental health challenges and mental health crises. So it was kind of born out of that conversation 25 years ago. So this is like the 25th anniversary year. And then it got brought to the United States in about 2008. And then since then, it's been a movement that's growing in a lot of different countries, like I want to say 22 plus countries. So we like to think about it as it's a training, but then it's also like a movement. We refer to all the learners, and as you probably remember, Stephanie, saying mental health first aider, kind of you're coming into the movement.
I so appreciate that because This is a topic, I mean, we talk about it, but we don't really know, but kind of, right? Like for sure there's more talk about it in today's world than like when I was growing up. But I still think we get tripped up on like, maybe we notice something, but we're like, is that okay? Am I supposed to acknowledge it? Am I supposed to say something? And if so, what? And this training really helps break all those barriers down in such a really easy and nice way.
Yeah. And Stephanie, what you're sharing too about that pause that maybe people have about initiating the conversation. That's why one of the things we teach in the course is an actual framework of what to say, what actions we can take, and how to offer support. And so that framework includes everything from how we assess a situation and assessing for safety considerations, as well as assessing, am I the right person to be having this conversation? Or is there somebody who might have a stronger relationship with that individual? We're teaching people how to utilize active listening skills, how to provide hope, how to give reassurance. And then also, again, going back to then who are those professionals? If we're within a company or organization, who are the professionals within the workspace, or who are the professionals in the community that could be helpful? And then that last part of the action plan, we focus on what are things that person can do themselves as a way of encouraging self-help and other support strategies. So that framework learners find to be really helpful, and having the skills that they can lean into as needed.
What do you guys see as some of the biggest barriers when people are showing up to this training? What are some of the maybe misconceptions people have that you love to kind of help break down and reset for people?
I love what you had said earlier when you had asked us that first question, where you said, people are worried about what to say. And we hope that we are able to convey that there's not one way to provide support. And also so that you're not getting a script, or it's not you're not a robot and there's not one perfect way, that you really get to kind of honor your humanity and you do the best that you can. And so you say the words, you try your best. And then if it doesn't land, you try again. I kind of really encouraging people that we're not looking for perfection. Like being a mental health first aider doesn't mean being perfect. It's just trying. It's trying. Anything you would add to that, Jill?
I think some of the common misconceptions that sometimes we help people work through is sometimes people will have pause around having conversations around mental health and really questioning of it. Is it my place to actually talk to a coworker about something they might be experiencing? And so we think about, what are the number one ways in which we can break through that stigma, that concern about even starting these conversations. And it's through skill building and training and education, and we know that to be true. And so we think about how we can overcome that barrier, training, education, opportunities to practice the skills right within the mental health first aid training.
I bet there's people out listening right now that are like, is it my place? I don't know. And maybe I'm feeling like I'm their boss. And so is that uncomfortable? Or I'm their peer. I mean, I could sit here and talk my way out of all the reasons why I shouldn't have to, or I shouldn't be the one to say anything.
Well, and one thing that I will add is we a lot of times in the course say, just like heart attacks don't happen in ERs and, or physical health, broken bones don't happen in doctors' offices, right? Mental health challenges don't happen in therapists' offices, right? And so we know that even if we are feeling a little bit reluctant, and that's, can be typical, especially from the communities that you might come from or your workplace culture, if you don't, then, and if everyone's thinking that, who will, right? And so it's really kind of connecting this to community care. This is part of us being in community together, is if you were coughing nonstop, I would be checking in with you, like, are you okay, right? And the same is true for if you were experiencing signs and symptoms and they were kind of getting in the way of you being able to do the things you wanted to do at work or wherever. Just checking in is part of that, right? It's kind of creating that parallel to physical health.
I love that example. And in the training, one of the things that we learned is we're not doctors. So our job isn't to diagnose. We don't have to approach it from that angle. But just being aware of some of the signs that we could be on the lookout for is super helpful. And so I wonder if you'd be willing to share any of those kind of initial signs or some of the bigger signs that we should be thinking about.
When we talk about signs and symptoms, we actually talk about them across 4 different domains that we might notice changes. And we use a lot of that language, noticing skills, noticing changes. And so noticing changes across appearance, so how that individual is showing up, behaviors. And we also talk about noticing signs and symptoms in regards to somebody's feelings and emotions, and also thoughts. So looking at changes and noticing changes across those different domains as a mental health first aider, that's kind of one of our tools for our toolbox. I'm also going to pass it to Soumya if you want to expand upon signs and symptoms.
One of the things that we teach in mental health first aid is that we don't make assumptions. And so we might notice some signs and symptoms. So let's say I notice that, Stephanie, you were late to work or late to joining a meeting, whether it's a virtual space or coming into a work meeting, and it happens once or maybe twice. It would not be appropriate, or it's not in my lane as a mental health first aider to automatically assume that that's a sign or symptom of mental health challenge, right? We're starting to notice signs that we're sometimes noticing patterns. We're also noticing how much is this happening and what's the impact. Really, we kind of want to come back to impact. And so is it that you come in a little late and then you dive right in, or you're missing important deadlines? Is it you're missing important things? You're not responding to emails. You're not showing up for things. So the list of signs and symptoms is pretty exhaustive. It's across those 4 domains, but we really tell mental health first aiders, that we don't make assumptions, that what we're noticing is automatically connected to a mental health challenge. And also we're looking for how long has it been going on for and what's the impact.
So let's just play it out. Let's say that I did notice that with somebody, I guess we said it could be appropriate for me to be the one to say something. And then, with the framework that you guys teach, it's here are some ways that you could approach that person or that situation. Or I love what Jill said, maybe you decide I'm not the right person to do it, but let me tag somebody else in or get a different resource, which I think is so important, because it doesn't mean I get to ignore it. It just means I might find help, but in a different way.
Yeah. And that's one of the messages that we really like to emphasize in mental health first aid, is that you are still an incredible mental health first aider if you recognize signs and symptoms and you tag someone else in who has that relationship and can have that supportive conversation.
When do we need to be worried? I mean, this is such a problem in the legal industry. I'm just thinking, as we were sitting here talking, we all know of people who've had serious issues across, sadly, everything from depression. I don't even know what the lowest level is, right? I'm what's the bottom all the way up to sadly death by suicide. It is plaguing our profession, which is why I thought for sure this conversation's so important, because we know we're in high stress, high impact jobs, and this is a real problem for a lot of legal professionals. And I think there's a little bit of, when we've talked about this on the show before, in the past, there's been a stigma around getting help because people were worried that maybe it would affect their licenses if there was worry from the state level that somebody couldn't perform their job.
The literature, backs that up, Stephanie. So, and when people have done studies on professionals within the legal industry and prevalence of mental health challenges, they are high. So it's not one person over here or one person over there. It's we, us, our community. And then I love that you're bringing up what might be a barrier for people getting help, which is really unique to the legal industry, is people worrying about their judgment. If I have signs and symptoms of a mental health challenge, will people doubt my judgment? Will people think that my judgment is now impaired, that I can't do my job? And so that's definitely a barrier for people getting help, right? And I think that the legal industry is trying to get ahead of that and naming that this is important. This is part of professionalism and professional development, that well-being helps you do your job, and that we can't just kind of ignore it, right? Because we know that our colleagues need support in physical health challenges and also mental health challenges. And so I think you're naming the prevalence, but then also naming some of the barriers that get in the way.
What would you say to people who are business owners? And, so we have a lot of small law firm owners who listen to the show. And I feel as a business owner or as a leader, maybe as a team leader, we have different levels of responsibility for the people who work with us. And so I guess, what do you say to those people about how they should be thinking about their role, maybe even differently than just, a colleague?
One of the things that I'll note, and then I'll pass it to Soumya to share more too, is one of the things we talk about in the course is the importance of self-care and the importance of all of these different skills. And we also like there to be some reflection when it comes to leadership of looking to your leadership to be able to see that modeled. And so when we think about the role of leadership, one of the really powerful roles of leadership could be to model the skills and the expectations for individuals that you're supervising. And so when we talk about these skills, it's not one layer within an organization. It's really looking at how is leadership modeling the skills that we're asking folks to be able to absorb and take on.
I mean, to echo what Jill is saying, a lot of times when we consult with firms and organizations, sometimes leadership might say one thing and then do another, right? And so we know, for example, that a workplace environmental factor within the legal industry is kind of this work-life conflict, right? Because there's connection to billable hours and there's perfectionism that's expected, right? And so, but if your leadership is saying, yeah, enjoy your weekends, take time off, but then they're sending emails and messages on weekends and they're working, that is like a mismatch, right? And people notice that. Whereas if leadership is modeling like, I'm taking rest, like I am really run down and I know I need to get ahead of this and I'm taking rest, or I'm going to, not be able to do this today because of this. If that kind of modeling, people see that really speaks volume. So kind of on a small scale, modeling what you're wanting for your colleagues or for the people on your team and in your firms really goes a long way. I also think about, from a training perspective, there is a difference that sometimes we notice between firms that the leadership is in the training with mental health first aid, or they're like, yeah, sign off on the training. And so when they're in the training to actually absorb the skills and are like doing it alongside colleagues and their team, that really kind of lands differently. It's promoted differently. People pay attention differently. People interact and take in that information differently versus maybe leadership that just kind of signs off on it. And I don't want to, infer, but, I can guess that people are wondering, top down, are people also believing in this? Are they behind this? So I think about those two as potential strategies to think about as a small firm owner.
What about any other kind of like best practices for the team as we're, beyond just everybody should get this training? I'll just plug that and I'll let you guys, talk about that in a second. But I'm just kind of thinking of other like easy best practices. If someone was listening and I was like, I should do a little bit more when it comes to the mental health of my team. What are some of your top tips that you would share?
First thing that I want to mention is just in regards to dosing. And then Soumya, I'd love to hear like more strategies as well. When we think about dosing of the information, so we know that a mental health first aid training is fantastic, right? But it needs to also be more than that. If we're really looking at changing how we show up for each other and how these conversations or what these conversations can look like in the workplace. And so whether that be a mental health first aid training as a way of that's our baseline, everyone has that information, but then following up with opportunities to practice skills, opportunities to develop community of practice and be able to not only practice scenarios, but also be alerted of new and emerging resources and information.
We really talk about, or we try to emphasize that we kind of sometimes can't self-care our way out of things. So like, yes, we need to have agency and we need to do individual things to take care of ourselves and thinking about it across different dimensions. Like the course goes over 8 different dimensions, and that's also echoed by the SAMHSA, the Substance Abuse Mental Health Services Administration. They came out with like some dimensions to think about taking care of yourself. But I also think about how can we create like workplaces where we extend and receive care to really freely. That I know that if I have capacity to give to you in this way, then Stephanie, you might take it and then you might give to me in another way. Almost like breaking down this like this notion that we need to power through it all by ourselves. Like I think that workplaces where there's really great retention, really easy to recruit people to work, and productivity and wellness are all kind of coexisting. I really do think that they have community care going on in their workplace. Like they're like, my well-being is connected to your well-being, and I see you like needing this, and I'm going to give that to you, and you see me needing this, and you're going to give that to me, and it's like both extending and receiving care. And this is not something that's like new, right? Like communities have been doing this for generations, but kind of bringing that back in. I think there's a little bit more of like when we went the self-care route and we kind of coined that, it's like self-reliance almost, right? And it's like, oh, how can we make sure that we're saying, yes, I have agency in taking care of myself, but also how can I have a community around me that's going to help me? Because we can't do it alone. Like sometimes I feel guilty. I know Jill and I, we talk about this as practitioners in this field. we sometimes feel guilty, like I should be doing this and I should be doing more of this and I should be doing that. And it feels like another thing yet I failed at. When reality is the structures around us are not set up for me to be able to succeed. And so the only way I can do that is if I lean on my community. And so this giving and taking has got to be, can we do that more in our workplaces and not be seen as weak, not as seen as having poor judgment, not as seen as not being good enough at our job. It's like, no, this is just how we do things.
Yeah, and when we think about that extending and receiving piece as well, so many times when we talk about workplace wellness, we think about literally the workplace environment. And one of the things that we emphasize in mental health first aid when we're teaching courses is we do not just put like stressors and things that are happening in our personal life like on a little bookshelf, and then we log into work, right? That's not how we live our lives. And so really thinking about looking at all of who somebody is and all of the stressors and all of the ways in which we can offer support, moving it beyond workplace wellness and thinking about, again, entire people, entire communities, and how this really fits to build capacity and support.
I also think that one of the things that we've helped organizations do is thinking about doing like relationship-centered practices alongside the way they do business. And so one of those, which is like so easy, and a lot of people are like, oh, of course, but it's even just starting meetings with a check-in. And it doesn't have to be a long check-in. It doesn't have to be like everybody gets 10 minutes for the floor, but it's like check-ins like, what's a rose thorn or rosebud that's happening in your life right now? Or it's a check-in like, here's some images of 16 animals. Pick the one that captures how you're feeling right now. Or it's, what's your internal weather thermometer right now? And that just like honors our humanity. And what a great way to be like, oh, I know that Jill right now, she just said that she feels like a tornado. Okay, like I know that. Like that's good for me to know as her supervisor, or that's good for me to know as her colleague. So I will care for her in that way. I might check in with her, or I might just give her a little slack if she's a little behind on something, right? Mm-hmm. So just doing check-ins can be really, really helpful.
I love that really practical tip. And I think it also, I was thinking while you both were talking, we talked about modeling, like the leader modeling the self-care, but also, we talk a lot about authentic leadership and being willing to be your authentic self with your team. I think for a long time we've been told like leaders have to have this wall up or these guards, like you're supposed to show up. I mean, I remember one of my law partners, this was many, many years ago, pulling me aside and being like, Stephanie, you're sharing too much about your personal life with the team, like with the staff. Like the staff isn't supposed to know about your life because you're a leader. And I just was like, what a dumb thing to say. Okay, well, like we're not on this weird pedestal. It's just that I have a different role on the team than they do. It's not like that's just such a antiquated way of thinking about it. And so now, I will share that I've gone to my team before and been like, hey guys, if I seem off, like I'm struggling, there's some stuff going on. Maybe I don't want to share all of my personal life, and you don't have to, but I've said like, hey, there's some stuff going on in my personal life. I just need y'all to know, like, I really don't want to share all the details right now, but it may be impacting how I'm showing up on calls. It may be impacting how I'm showing up for you right now. And it may have nothing to do with you, because I think a lot of times teams especially really, like I was reading about like teenagers and how they don't perceive facial expressions always correctly. And I see that a lot with my kid where she'll be like, Mom, why are you mad? And I'm like, I'm not mad. Why do you think, I feel like that also kind of applies to our team members sometimes. Like they put more on us, like, oh my gosh, Stephanie's showing up at this call. She must be really mad at me. And it may have nothing to do with them. It's just, I'm mad at the teenager that we just talked about. So, I think just us being willing to be that vulnerable and authentic and share that with our team that, hey, we're human too. And I may feel like a tornado today.
Absolutely. It's our like natural human tendency to want to fill in the blanks. And so if we don't have all the information, we tend to make assumptions. Unfortunately, those tend to be negative assumptions, right? So like, why is she showing up to this meeting late? Whereas if we can just be transparent and honest, it helps to fill in those blanks. We don't have to guess. We don't have to wonder. We just know.
Mm-hmm.
Awesome. If people are excited, as they should be, to get this training and help get their team trained too, I think it's an easy first step to me. Like you said, not the end of the story, but a good level set first step. Where can they go for more information?
So if you're interested in learning more about mental health first aid and specifically bringing mental health first aid to your firm, you can actually reach out to Soumya or myself. Stephanie, I'm not sure if our contact information can be made available as part of this podcast, but we will make sure that that is available to listeners so that individuals are able to reach out to us and be able to get connected to the training. If we're not able to facilitate that training, we'll be happily able to connect you to other facilitators who would be able to offer that training to you as well. So it's widely accessible, widely available. We're happy to be a point of contact moving forward for folks.
Yeah, we'll make sure all their contact information's in the show notes. So please go check it out there. And thank you both for being with me today, for being my trainer, but also just sharing this information with all of our listeners in our community, because I know it will help people.
Thank you so much, Stephanie.
Thank you for having us on.